Good morning, everyone. Thank you for joining us here today. We really appreciate it. And welcome to this week's very special press conference. Today, our focus is on a brand new initiative called Housing First Erie. Have you all heard about that? Housing First Erie. I'm excited to be joined today by several of our community partners presenting. My team and I are driven by our mission, which is build opportunity, restore hope, transform Erie. I'm proud to serve this city and each and every one of our residents as well. As I often explain, everything that my team and I do focuses on achieving our vision that Erie is a community of choice, and we celebrate our rich cultural diversity, our welcoming, vibrant neighborhoods, our world-class downtown and bayfront, our excellent education for everyone, and our abundance of good family-sustaining jobs. We want to realize this vision for each and every person that lives in this area. It breaks my heart to know that some of our residents have been chronically unhoused now for more than a year. We have now joined together to do something about that. We're extremely proud of the programs and initiatives that we started in the Erie Police Department to address concerned businesses and residents both have about our downtown. We have expanded our approach to community policing with a specially trained crisis unit that was reinstated in May of 2023, so it's not quite a year since the reinstatement. It has 10 officers working around the clock to answer domestic calls, to help people in crisis with mental and behavioral health issues, and to connect residents to all needed services. The unit handles over 162 calls per month. I'm proud of the work and the holistic approach by the Erie Police. Responding to the unhoused who are experiencing a crisis and connecting them to the much needed services is vital, but it does not replace their need for a home, which they don't have. The City of Erie has been partnering with Infinite Erie for more than a year and a half now to come up with a solution to this. Renee Labus and Deborah Smith on our team have been at the table since the very first meeting a year and a half ago. We know that government cannot do it alone. Private sector, nonprofit, and philanthropic leaders all play a role in this transformational change that we're going to make sure takes place. Only by working together can we successfully resolve today's complex challenges like homelessness. I'm very excited about what this partnership will be accomplishing. The city is absolutely committed to Housing First Erie, and we're going to do everything in our power to help address chronic homelessness here in Erie. Next, I will turn the podium over to County Executive Brenton Davis, who will outline the challenges before us, the solution, and our ask. Then Karen Billowith and Boo Haggerty will tell you the details of our plan. County Executive.
Good morning. I just want to thank each of you for turning out today, for our community partners, Hammett Health Foundation, Erie Community Foundation, and countless others for being willing to step forward and face this issue collectively as a community. As we look to invest strategically our ARPA funds based upon data as opposed to what we've always done. Every year here in our community, we invest millions of dollars to face the challenges of the unhoused, and our problem's getting worse. So we're committed to utilizing the data and best practices and working collectively to make strategic investments. And I remind you, this is just one piece. This is just one piece of the unhoused continuum from streets to sustainability. So when you hear as this plan unfolds, this is not a single standalone effort, but one piece of a continuum from taking a person from instability in the streets to long-term, affordable, sustainable housing. I don't want to bore you with the data points, but the things that are important that we keep in mind are things like the 1,250 homeless youth here in Erie County, countless others of adults, folks in mental health crisis, and the reasons that lead them there. How do we diffuse the situation before it becomes an issue of losing housing? And those are the best practices, and those are the approaches that we're looking for. How can we stabilize the family unit before the county needs to step in and provide additional services? So as we work collectively together, I can't thank, there's too many folks out here. I see city council members, I see our crisis units, our different authority members, community partners, and I'd be remiss if I didn't mention all the county and city workers that work every day and our social service workers out there that face this head on each and every day. So I want to thank each of these folks for doing what they do, and I will turn the podium over to Karen Billowith. Thank you very much.
Thank you, Mayor Schember and County Executive Davis. As I was introduced, I'm Karen Billowith, and I'm pleased to serve as the Erie Community Foundation President. The foundation shares the vision that the mayor expressed of a thriving, healthy community where all residents benefit from economic and community development. In fact, last year we updated our mission and vision to articulate our desire to inspire, engage, and empower all community stakeholders toward a united, vibrant, and thriving region. We agree with the county executive that to achieve this vision, we need to work with public and private sector partners and engage residents in defining our challenges and defining solutions. Today, we are announcing Housing First Erie, a strategy that was developed through public, private, and philanthropic partnership working within the framework of Infinite Erie. Many of you may remember the investment playbook that was developed to leverage state and federal funding to spur economic and community development. The playbook was a set of 35 transformational projects that would collectively propel Erie forward. Addressing homelessness was a key priority that came out of the playbook. Together with Hammett Health Foundation and Boo Haggerty, we convened a robust project team to delve into this issue. And again, I want to thank the mayor and the county executive for allowing his team to really work on this initiative right from the beginning. The city, the county, Hammett Health Foundation, Highmark Health and Allegheny Health Network, Gannon University, the Housing Authority of the City of Erie, the Erie Home Team, Erie County Care Management, and Mercyhurst College were coming together on a monthly basis to set about defining the challenge and finding a solution. And this project team did extensive outreach in the community and had deep conversations to develop this strategy called Housing First Erie. Before I go on to describe Housing First, let me first say and repeat what the county executive said. Erie has multiple organizations addressing the immediate needs of those experiencing homelessness. They provide temporary shelter, food, life skills training, and many other needed services. What we're talking about today is addressing one piece of that work, and it doesn't distract from or take away from those organizations that are doing great work in the community. However, we still have an issue, and as county executive said, there are people in our community who have remained homeless or remained without a place to live for over a year, and those are the target of our Housing First Erie. So what is Housing First? The work is based on evidence-based model called Housing First, which believes that people achieve stability when rapidly connected with stable, permanent housing and intensive supportive services. Housing First has been studied and is considered the most effective model to end chronic homelessness. Once being housed, Erie should see clear outcomes. These outcomes that we see nationally are that 80% of people who are housed through Housing First will remain stably housed 1 year after their placement. The community will save over $25,000 per person per year in such costs as emergency service, ER visits, policing, corrections, emergency shelter, ambulance, etc. And we'll see decreased rates of trauma, addiction, and inpatient hospitalizations. But really, I think what we really want to see is that residents in our community have a stable place to call home and that then they can work on other challenges. This all takes intentional planning, commitment, and leadership, and one of the people who has been a steady force of leadership is Boo Haggerty with the Hammett Health Foundation, and he's going to talk a little bit more about this solution.
Good morning, everybody. Is everyone just a little cold? A little windy? Well, I think that's kind of ironic in terms of what we're talking about today, because we're talking about people who will have shelter in 10 minutes. Well, it's me talking, maybe 15. But anyway, we'll be able to get through this quickly. But how are we going to do this? And I guess the most important thing to say is everything outlined so well so far sounds easy, but there's going to be a process to this, and it's going to take a little time. We're going to need your patience, but we're going to need your partnership and your willingness to dig in. So there's 3 ways to tackle this. The Housing First model, we identified those 150 folks chronically homeless. Number 1 is the project team, and many of you are out there, and thank you for your willingness to be part of this project team. We've been meeting regularly and rapidly to get this going. The first piece is building a single unit apartment building in a location that we are still searching for right now, but we're honing in on. And we will be led on that project with the Cleveland Housing Network, who has done this very successfully in Cleveland. And they will build this apartment building in Erie. And they were selected a group of about 7 organizations that answered the request for qualifications. So the first piece is to properly find the place and build that apartment building. That will take time, as you understand, and that'll be done with a lot of federal and state dollars. The second piece is to find 100 scattered site units. These would have to be additive apartments to the community, because right now there's kind of a no vacancy rate on apartments available in this community, and it just can't be a place where you and I wouldn't live also. So we have to have 100 quality apartments. Those scattered site apartments, also a process to who's going to be the backbone for that. Our foundation has started a new community development corporation called Build, led by Executive Director Daria Devlin. You'll hear more about that in time to come, but we are the backbone, and it's our job to go find those 100 apartments, and they will be new. They will be maybe built on vacant land. They will maybe be blighted properties that we rehab. Maybe they're master leases of current apartments that we can get into, but we're in that process right now. Our goal is the first 25 scattered site apartments are ready to go by end of summer, and that is something that we have to move rapidly on. But the most important piece of this is having the services wrapped around. Many providers in the community and outside the community answered the RFQ to be who is going to be that service provider. And UPMC Western Behavioral Health at Safe Harbor was chosen. And led by their director, Mandy Fauble, and her team, Safe Harbor will provide those supportive services to those folks in their apartment on a regular basis. In some cases, depending on how chronic their issues are, on a daily basis if need be, to make sure that they are getting all those services wrapped around them immediately. And from there, to county executive's point, we can then get them back into the system. And the goal is to get them housed, stable, into the workforce, and leading the productive lives that we all know that they can lead. So that is the model. It's really that simple, but really that challenging as well. So to echo what Karen said, I do really want to publicly thank Mayor Schember and his team, because they have leaned into this hard. When we came in as a private enterprise to say we want to talk with you, they kept the door open and they said we want to partner with you. And I also want to really thank County Executive Davis. Before he even took the oath of office, he and I talked about this, and he saw this and he knew this to be an issue. He knew his teams in the county, led by John DiMatteo and Peter Burke and others, were on this every day and working diligently at this every day. But he made sure that the county's resources were open to us to make sure we could get to where we are today. So thank you both for your leadership and collaboration. The best news is now I can turn this back over to Karen, because we have to pay for all this. and Karen's going to lay out the plan of how we're going to do this with this partnership. So Karen, back to you.
That's an interesting way of saying that. So yes, there is a cost to all of this, and I think, just to repeat again, that the importance of public, private, and philanthropic partnership to make this happen is what will make this work. And that is because, as has been said, there is federal and state funding available to develop and build the units, but we also need private support to pay for those wraparound services that are so key. We know that our gap in funding is anticipated to be somewhere around $20 million, which sounds like a really big number. But truly, as we think about the costs that come on an annual basis, we will be saving money as a community, and we will see immediate return on our investment in the next 5 years. If we're successful, we'll see 150 people who have permanent housing. As I said earlier, saving about $25,000 annually per person. So if you are interested in learning more or want to get involved in some way, please contact me at Erie Community Foundation, and we can get you connected to the right resource. Of course, we will be looking for contributions, but we'll also be looking for input, engagement, and your support as we think about where these sites will be located throughout the community. Thank you so much for coming today, standing out here in the cold, and thank you to all of the media for covering this important topic.